Painful spot in ear canal. What is a spot in the ear? A spot or pimple in your ear has occurred from a blocked pore caused by hair follicles, sweat gland, or oil glands next to hair follicles. It's common and can happen to anyone inside the ear, outer ear, earlobe, or even behind the ear. You shouldn't pop them, as bacteria causing the issue can be pushed further towards the eardrum. Spots in the ear can be more painful than facial spots, as the skin is tighter and with more nerve endings. What causes a spot in the ear? Spot in ear causes are usually blocked pores from skin cells or oil, but they can also come from hormonal changes or stress. Bacteria can also cause an issue from fingers, earphones, pillows, or phones. Types of spots and bumps that can appear in the ear. Spots and pimples are blocked pores with either a white or black head from excess oil, dirt, or skin cells trapped with the hair follicle. Boils are usually larger and more painful from infected hair follicles or oil gland. It's possible for hearing to be affected if one appears inside the ear canal, as it can grow to block most of the passage. A cyst is a large lump that's usually not painful or red like a spot, pimple, or boil. If it continues to grow and/or becomes painful, then you should see a doctor.
Why are ear spots so painful? Pain comes from the skin being tighter than elsewhere on the body, with many nerves to send signals back to the brain. Headphones, earphones, and touching the area can make the pain worse. Should you pop a spot in your ear? No, advice is not to pop a spot in your ear because there's a chance it could scar, and bacteria could enter to make the situation worse with an infection, especially in the ear canal. How to treat a spot in the ear at home? Treatment at home is limited, but a warm compress several times a day while keeping the area clean will do the trick. Speed up recovering by using treatments such as benzoyl peroxide or salicylic acid. Apply between each compress to kill bacteria, unblock pores, and remove dead skin cells. How to prevent spots in the ear? Avoid bacteria in the area by using antibac wipes on phones, earphones, hearing aids, etc., and wash away hairspray to avoid pores being blocked. General cleanliness such as washing hair and face regularly, while also avoid putting fingers in your ears. When should you see a doctor? You should see a doctor about a spot in ear when it becomes too painful, keeps getting bigger, keeps returning, if you develop a fever, if discharge is coming out of the ear canal, your hearing suffers, or it doesn't heal after 2 weeks.